What's the best blood pressure for older adults? Know the real truth. If you find yourself over the age of 70 and your physician has recently applauded their success in lowering your blood pressure to the seemingly ideal reading of 120/80, it is imperative that you fully comprehend the vital information presented here. A groundbreaking study, meticulously published in the prestigious Journal of the American Medical Association, meticulously followed and analyzed the health outcomes of an expansive cohort of 15,000 senior individuals over a significant 5-year period. What these dedicated researchers uncovered fundamentally challenges and indeed directly contradicts nearly every piece of conventional wisdom and established guideline we have been taught concerning optimal blood pressure targets for older adults. Far from being a marker of perfect health, the seniors in this study who maintained what is commonly referred to as perfect blood pressure exhibited an alarming 28% higher propensity for experiencing serious, life-altering falls. Even more concerning, their overall mortality rates were demonstrably worse than those individuals who maintained moderately higher blood pressure numbers. Over the next few moments, we will delve deeply into this critical data, revealing the precise blood pressure range scientifically linked to the longest survival rates in older adults. We will uncover the compelling reasons why the long-standing standard target of 120/80 might not only be ineffective, but potentially hazardous for individuals beyond the age of 75, and we will equip you with a single, straightforward test you can perform in the comfort of your own home tonight, a test that holds the potential to avert a devastating fall and safeguard your independence. I am Dr. Michael Kent, and the insights I am about to share are not merely academic. They possess the genuine capacity to preserve your life or profoundly impact the well-being of someone you deeply care about. Before we embark further on this crucial discussion, I encourage you to pause for a moment and simply share your age in a comment below. No additional details are needed, just your age. This helps me understand our audience, as the nuanced information we are about to explore has varying implications depending on whether you are 65, 75, or 85 years old. Furthermore, if you have ever experienced that unsettling sensation of dizziness, lightheadedness, or a momentary loss of balance when rising from a seated position, perhaps from a comfortable chair, or when getting out of bed in the morning, please add the word dizzy to your comment. This specific detail provides invaluable insight, and you will soon understand its profound significance in the context of preventing falls, an explanation we will fully explore in just about 3 minutes. To truly grasp the gravity of this issue, let's consider a scenario that unfolds with unsettling frequency in medical offices across the nation every single day. Envision a 78-year-old individual arriving for their routine checkup. Their blood pressure reading registers at 145/86. The attending physician, diligently consulting the standard medical guidelines displayed on their computer screen, observes the prescribed target of less than 130 systolic. Without hesitation and with the best of intentions, they reach for their prescription pad. A medication is added to the patient's regimen, and perhaps a few weeks later, another is introduced. Over the subsequent 6 months, the patient's blood pressure steadily and beautifully declines, eventually stabilizing at an impressive 124/78. The doctor is justifiably pleased, marking this achievement as a success in the patient's chart, and indeed, everyone involved perceives this as an optimal outcome, a testament to effective medical management. However, the prevailing guidelines, designed with a younger demographic in mind, tragically overlook a critical and often perilous reality. That same 78-year-old patient, now lauded for their perfect blood pressure, rises during the night to use the bathroom. In a matter of mere seconds, their blood pressure, which measured an ideal 124/78 while seated, plummets dangerously to a critically low 88/56. Their brain, deprived of sufficient blood flow, struggles to maintain equilibrium. The room begins to spin disorientingly, vertigo sets in. They instinctively reach out for the reassuring solidity of a wall, but their coordination fails. Their grasp misses its target. In an instant, the conversation is no longer about blood pressure numbers on a chart. It transforms into a grim discussion about a fractured hip, necessitating emergency surgery, followed by a grueling 3-week stay in a rehabilitation facility. This initial injury often triggers a devastating cascade of complications, infections, deconditioning, and emotional distress that far too often culminates in an irreversible loss of independence, and in the most tragic instances, a premature end to life. The pivotal research, published just a few months ago in JAMA Internal Medicine, a publication of immense scientific authority, should have undoubtedly generated widespread headlines across every media outlet. Yet, astonishingly, a significant majority of medical professionals remain unaware of its profound implications, and the vast majority of patients have certainly not been informed. This disconcerting chasm between cutting-edge scientific discovery and routine medical practice is not merely an academic concern. It is a tangible, life-threatening gap that is demonstrably costing lives and diminishing the quality of life for countless older adults. What you are about to discover will likely sound profoundly counterintuitive, challenging deeply ingrained beliefs about health and aging. It is crucial that you remain engaged and open-minded, as this is precisely where our understanding of blood pressure management undergoes a fundamental transformation. For many decades, the medical community has adhered to a deceptively simple and universally applied mantra: lower blood pressure unequivocally equates to better health outcomes. And for a specific demographic, namely middle-aged adults typically in their 40s and 50s, this directive is largely accurate and undeniably beneficial. Proactively bringing blood pressure under control during midlife has been conclusively proven to prevent the incidence of heart attacks, mitigate the risk of strokes, and protect against the progression of kidney disease further down the road. The evidence supporting this approach for the younger and middle-aged populations is unequivocally rock solid and beyond dispute. However, a critical and often overlooked physiological shift occurs after an individual reaches approximately 75 years of age. The robust body of recent research now clearly demonstrates that seniors who maintain a systolic blood pressure within the range of 130 to 145 actually experience significantly longer lifespans compared to those whose systolic pressure is kept below 120. Furthermore, this moderately elevated group experiences a markedly reduced incidence of falls, fewer debilitating fractures, lower rates of hospitalizations, and notably, superior cognitive function. Conversely, the group of older adults who painstakingly achieved that textbook perfect 120/80 blood pressure, the very target so often praised, exhibited disproportionately higher rates of dizziness, syncope, the medical term for fainting, acute kidney injury, and regrettably, a higher overall mortality rate. Now, if you are an individual who deeply values understanding the underlying why behind medical recommendations rather than simply being told what to do, then the comprehensive explanation that follows will furnish you with an entirely fresh and profoundly different framework for conceptualizing blood pressure management as you navigate the aging process. Your cardiovascular system at 75 years of age is not simply a slightly older rendition of your cardiovascular system at 45. It is, in fact, fundamentally distinct, altered in profound ways that irrevocably change what specific blood pressure numbers truly signify for your overall health and well-being. Allow me to elucidate the 3 paramount physiological transformations that invariably accompany the aging process, and why these fundamental changes absolutely necessitate a revised and individualized approach to blood pressure targets for older adults. Firstly, we must consider arterial stiffness. As you advance in years, a natural and unavoidable process occurs within your circulatory system. Your arteries progressively lose their inherent elasticity, becoming stiffer and less pliable. To illustrate this, consider the stark contrast between a brand new, flexible garden hose and one that has been left exposed to the sun's harsh elements for 2 decades. The older hose is rigid, brittle, and significantly less flexible. Your own arteries undergo a remarkably similar degenerative process, medically termed arteriosclerosis. When your heart, a powerful muscular pump, propels blood into these increasingly stiff and unyielding arteries, they are simply unable to expand and effectively absorb the sudden pressure wave with the same efficiency and resilience as younger, more flexible arteries. This crucial inability means that your body, particularly your brain and kidneys, requires a slightly higher baseline pressure to consistently ensure that adequate blood flow reaches these vital organs, especially when you are standing upright and blood must actively flow against the relentless force of gravity. A lower pressure in this context can mean insufficient perfusion, leading to serious consequences. Secondly, there is a marked decline in baroreceptor function. Baroreceptors are a sophisticated network of minuscule, highly specialized sensory nerve endings strategically embedded within the walls of your major blood vessels, particularly in the carotid arteries and the aortic arch. Their essential role is to continuously monitor and instantly detect even the slightest fluctuations in blood pressure. Upon sensing a change, they immediately transmit signals to your brain, which then initiates rapid compensatory adjustments to maintain circulatory stability. For instance, when a young individual swiftly stands up, their baroreceptors detect the instantaneous drop in blood pressure within milliseconds. This triggers an immediate cascade of compensatory responses. The heart rate accelerates, peripheral blood vessels constrict to reduce capacity, and blood pressure swiftly stabilizes. However, these vital baroreceptors become progressively less sensitive and responsive with advancing age. Their reaction time lengthens, and their ability to trigger robust compensatory mechanisms diminishes. Consequently, if your baseline blood pressure is already artificially lowered by medication and your age-impaired baroreceptors are sluggish in their response, you become highly susceptible to that perilous and precipitous drop in pressure when you stand, a dangerous condition medically known as orthostatic hypotension. Thirdly, medication metabolism undergoes significant alterations. As we age, the efficiency of our vital organs, particularly the kidneys and liver, in processing and clearing medications from the bloodstream, inevitably diminishes. A dose of blood pressure medication that is perfectly appropriate, safe, and effective for a middle-aged individual can prove to be excessive and potentially dangerous for an older adult. The medication lingers in your system for a longer duration, exerting stronger and more prolonged pharmacological effects, thereby substantially increasing the risk of pushing your blood pressure to dangerously low levels. This altered pharmacokinetics means that careful titration and a nuanced understanding of an older patient's metabolic capacity are absolutely essential. Now, let me provide you with the exact specifics of what this groundbreaking recent research definitively revealed, because in this context, the precise details carry immense weight. The study, published with meticulous rigor in JAMA Internal Medicine, meticulously tracked an impressive cohort of 15,142 adults, all over the age of 75, for an average duration of 5 years. It is crucial to emphasize that these participants were not a carefully selected group of perfectly healthy, robust seniors. Rather, they represented a diverse and authentic cross-section of real-world older adults. This included individuals managing chronic conditions such as diabetes, those with a history of prior strokes, individuals with existing heart disease, and participants exhibiting varying degrees of frailty. The dedicated researchers systematically monitored their average blood pressure readings and then meticulously observed and documented their health trajectories over the entire 5-year follow-up period. To facilitate analysis, participants were stratified into distinct groups based on their average systolic blood pressure. One cohort consistently maintained systolic pressure below 120 mmHg. Another group fell within the 120 to 130 mmHg range. A third group recorded readings between 130 and 140 mmHg. A fourth group ranged from 140 to 150 mmHg. And finally, a group whose average systolic pressure consistently exceeded 150 mmHg. Herein lies the profound and startling discovery. The cohort that exhibited the absolute lowest mortality rate, indicating the longest survival, was astonishingly found in the group with an average systolic pressure maintained between 130 and 140 mmHg. This was emphatically not the group below 120 mmHg, the textbook perfect number that is so widely advocated. Instead, it was the group maintaining a moderate, seemingly higher range. Those older adults whose systolic pressure was kept below 120 mmHg experienced a significant 28% increased risk of severe falls requiring hospitalization, an outcome with often devastating consequences for the elderly. They also exhibited higher rates of acute kidney injury, a clear indication that their kidneys were struggling to function optimally with the artificially lowered pressure. Furthermore, their overall mortality rate was a notable 14%. Higher than those individuals maintaining their systolic pressure within the 130 to 140 mmHg range. As one might intuitively expect, the group with systolic pressure consistently above 100 mmHg also encountered significant health challenges, including higher rates of stroke and a greater incidence of other major cardiovascular events. However, the truly unexpected and alarming revelation was that an excessively low blood pressure was found to be just as dangerous, if not more so in some contexts, as an excessively high blood pressure for this demographic. The true sweet spot, the optimal range consistently associated with the longest survival and the highest quality of life for older adults, was definitively higher than the conventional, widely disseminated guidelines currently recommend. Let's revisit our earlier scenario, painting a more vivid picture of how this misunderstanding can unfold in real life. Imagine you are 76 years old and you attend a routine checkup at your doctor's office. Your blood pressure reads 142/84. Your doctor, observing this number in the context of conventional guidelines, expresses concern. They pull up the established recommendations on their screen and assert, "We absolutely need to bring this down to at least 130, ideally closer to 120. You are promptly prescribed a blood pressure medication. 2 months later, your pressure registers 128/78. Your doctor is visibly pleased with the progress, but still aiming for that ideal number, suggests adding a second medication to nudge it just a bit lower. Another 2 months pass, and your pressure now stands at 122/76. Perfect, your doctor exclaims, fully confident in their successful intervention. Initially, you might feel perfectly fine, but gradually, subtly, you begin to notice something amiss. When you rise from your comfortable armchair to answer the telephone, you experience a momentary, disconcerting lightheadedness, a transient sense of imbalance. When you stand up from the dinner table after a meal, there's a fleeting split second where the entire room appears to tilt precariously. You mention these observations to your doctor, who, perhaps busy or not fully aware of the latest research, dismisses them as probably just age-related. They suggest, "Your blood vessels are just adjusting more slowly now. Just stand up gradually, take your time." But what is actually transpiring is far more serious than a simple age-related adjustment. Your blood pressure, which presents so impressively and ideally when you are sitting still and relaxed in the doctor's office, is, in reality, plummeting dramatically when you transition to a standing position. That seemingly perfect 122/76 while seated might drop precipitously to something like 95/60 when you stand upright. Your brain is consequently experiencing repeated transient episodes of inadequate blood flow, moments of cerebral hypoperfusion. You are, unbeknownst to you or your doctor, at an alarmingly high risk for a devastating fall, yet this critical danger remains entirely undetected because your sitting blood pressure, the only one routinely measured, appears textbook perfect. This dangerous scenario, tragically, plays out thousands of times each and every day across the country, and the most poignant aspect is that it is largely preventable, provided we embrace the understanding that blood pressure targets must be thoughtfully individualized based on an older adult's age, their specific medical conditions, and their functional status, rather than being indiscriminately applied as a universal, one-size-fits-all metric. Here's an aspect of this situation that is profoundly shocking to me, and I believe should be to everyone. There exists a straightforward, rapid test, taking approximately 3 minutes to complete, that possesses the remarkable ability to identify whether your current blood pressure medications are inadvertently placing you at a heightened risk for falls. This vital diagnostic tool is known as an orthostatic vital sign measurement. Yet, disturbingly, the vast majority of doctors are simply not incorporating it into their routine examinations of older patients. Let me now empower you by teaching you precisely how to conduct this potentially life-saving test in the comfort of your own home tonight. This knowledge could genuinely be a game changer for your health and safety. You will need a reliable home blood pressure monitor. These devices are readily available at virtually any pharmacy for an affordable price, typically around $30. Here is the exact protocol to follow. 1. Rest. Lie down completely flat on your bed or a comfortable couch for a full 5 minutes. This period of rest is crucial for allowing your cardiovascular system to stabilize and establish an accurate baseline reading. Simply relax and breathe normally. 2. First measurement, lying. After the 5 minutes of rest, check your blood pressure while you are still lying down. Make sure to accurately record both numbers, the systolic, the top number, and the diastolic, the bottom number. 3. Second measurement, standing. Immediately after taking your lying measurement, stand up. Do not hesitate or wait. As soon as you are in an upright standing position, check your blood pressure again right away. Record these new numbers. 4. Comparison and interpretation. Now, carefully compare the two sets of numbers you've recorded. If your systolic blood pressure, the top number, dropped by more than 20 points, or if your diastolic blood pressure, the bottom number, dropped by more than 10 points when you stood up, you have orthostatic hypotension. This finding constitutes a significant red flag. It strongly indicates that your current blood pressure medications may be too potent for your individual physiology, or that your prescribed target blood pressure is simply too low for your body's specific needs as an older adult. Even if your sitting or lying blood pressure readings appear perfect according to conventional standards, if they are plummeting dramatically when you stand, you are unequivocally at an increased and unacceptable risk for falls. To make this even more concrete, consider these specific numbers. Imagine your blood pressure while lying down is 125/78. On paper, this looks exemplary. However, when you stand up, it drops precipitously to 98/64. That represents a 27-point drop in your systolic pressure. This is unequivocally dangerous. Your brain, for a significant portion of your waking hours, when you are upright, is receiving inadequate blood flow. While you might feel perfectly fine when you are lying down or sitting, the moment you assume a vertical position, your body is operating on insufficient pressure, compromising vital organ function and increasing fall risk. This is precisely the test your doctor should be performing at every single visit if you are over 70 and taking blood pressure medications. If they are not routinely doing it, you now possess the knowledge and ability to perform it yourself and bring the invaluable results to your next appointment, becoming an empowered advocate for your own health. So, given all this nuanced understanding, what should your blood pressure actually be? I am going to outline the ranges that the latest research strongly suggests are associated with the best possible outcomes for different age groups within the older adult population. However, it is absolutely essential to internalize that these are general guidelines, not immutable, absolute rules cast in stone. Your personal, individualized target blood pressure should always be determined through a collaborative and informed discussion with your physician, taking into account your complete medical history, existing health conditions, and overall functional status. For adults generally aged between 65 and 74 who are in good overall health and maintain an active lifestyle with no major complex medical conditions, research indicates that a systolic blood pressure range of 130 to 140 mmHg is considered reasonable and provides optimal balance. This range offers crucial cardiovascular protection while simultaneously ensuring adequate blood flow, perfusion, to all vital organs, thereby reducing the risk of conditions like acute kidney injury or cognitive impairment. For adults aged between 75 and 84 years, who are relatively healthy and functionally independent, the compelling evidence supports a slightly higher systolic range of 135 to 145 mmHg. It is important to note that this target is deliberately higher than for the younger group. This adjustment intelligently accounts for the increased arterial stiffness that is characteristic of this age group, as well as the slower and less efficient responses of their baroreceptors, minimizing the risk of orthostatic hypotension and its associated dangers. Finally, for adults over the age of 85 or for any individual who exhibits significant frailty regardless of their chronological age, a systolic range of 140 to 150 mmHg may, in fact, be the most appropriate and beneficial target. At this advanced stage of life, the primary objective often shifts from aggressive blood pressure lowering to prioritizing the prevention of debilitating falls and the crucial maintenance of an acceptable quality of life, understanding that the risks of overtreatment often outweigh the potential benefits. Now, what about the diastolic pressure, that crucial bottom number? For older adults, diastolic pressure should generally be maintained above 65 mmHg, ideally falling within the range of 70 to 85 mmHg. A very low diastolic pressure can significantly reduce blood flow to the heart muscle itself during its vital relaxation phase, diastole, potentially causing problems such as angina or ischemic events. If your diastolic reading is consistently below 60 mmHg, even if your systolic pressure appears satisfactory, this is a critical issue that warrants immediate discussion with your healthcare provider. Let's consider a more complex patient profile. A 73-year-old individual who has been living with type 2 diabetes for several years and has a history of experiencing one heart attack 5 years ago. Their current blood pressure is consistently recorded at 148/86. Should this person automatically aim for the conventional perfect target of 120/80? Probably not, as this could introduce significant risks of orthostatic hypotension and falls, which could be catastrophic given their medical history. Conversely, should they aim for a much higher 150/90? Also probably not, as this might not adequately protect them from further cardiovascular events given their diabetes and previous heart attack. For an individual in this nuanced situation, the most recent research thoughtfully suggests that a systolic target around 130 to 135 by mmHg might prove to be optimal. This range is sufficiently low to provide necessary cardiovascular protection, crucial given their diabetes and history of heart disease, but critically, it is not so low as to introduce the dangerous risk for orthostatic hypotension and the devastating falls it can precipitate. The absolute key in such complex cases is that this target must be approached gradually, with meticulous and careful monitoring for any potential side effects every single time a medication dose is adjusted. Orthostatic blood pressure measurements should be checked diligently, and any new symptoms reported by the patient, dizziness, unexplained fatigue, a persistent feeling of foggy thinking, must be thoroughly assessed. These seemingly innocuous symptoms could be critical indicators that the blood pressure is being lowered too aggressively, even if the numbers on paper appear to be within a desired range. Moreover, here's another crucial aspect most people, including some healthcare providers, don't fully appreciate. Blood pressure naturally fluctuates throughout the day. A single reading of 148/86 at a particular moment does not definitively mean your pressure is consistently that high. It might well be 132/78 in the early morning and rise to 145/84 in the evening, reflecting your body's natural circadian rhythms and responses to activity and stress. What truly matters for effective management is the average blood pressure over a period of time. This is precisely why consistent home blood pressure monitoring is so incredibly valuable. It provides a far more accurate and comprehensive picture of your true average pressure than isolated, occasional office readings, which can be influenced by factors like white coat hypertension, elevated readings due to anxiety in a clinical setting. You might reasonably be wondering if such compelling research exists and is readily available, why your own doctor has not brought this critical information to your attention, why indeed aren't blood pressure guidelines for seniors distinctly different and widely publicized? The answer to this complex question is multifaceted, but it largely boils down to the inherent inertia of how slowly medical practice typically evolves and the intricate, often drawn-out process by which clinical guidelines are established and disseminated. Most contemporary blood pressure guidelines are founded upon the results of extensive, large-scale clinical trials conducted over many years, often requiring substantial funding and participant recruitment. The landmark trials that originally established 120/80 as the universally ideal target were primarily conducted on cohorts of middle-aged adults, individuals typically in their 40s, 50s, and early 60s. When the definitive results from these trials were published, the guidelines formulated from them were, with good intentions, broadly applied across all adult age groups. There was an underlying, albeit flawed, assumption that what was demonstrably good and beneficial for a 50-year-old must logically also be optimal for an 80-year-old. However, over the past decade, a new generation of dedicated researchers has begun to specifically focus their investigative efforts on older populations, and what they are consistently discovering is that a one-size-fits-all approach is demonstrably unsuitable and, in fact, often detrimental for the elderly. The inherent problem is that it takes a significant number of years for new, compelling research findings to fully filter into and influence established clinical guidelines. Even after guidelines are updated, it often takes an even longer period for these revised guidelines to permeate and fundamentally alter routine clinical practice across the vast and diverse landscape of healthcare. Many doctors are still operating based on guidelines that were published 5 or even 10 years ago, simply because the process of continuous medical education and guideline adoption is slow. They may not yet have encountered or fully assimilated the most recent research unequivocally suggesting that a moderate elevation in blood pressure is, counterintuitively, actually safer and more protective for very old adults. there is also a profound psychological factor at play. For countless decades, medical professionals have been rigorously taught and had it deeply instilled in them that lowering blood pressure is an absolute imperative that consistently saves lives and prevents disease. This powerful and pervasive message has been deeply drilled into their professional mindset. It is undeniably challenging to shift from such a firmly entrenched paradigm to a more nuanced, individualized approach that acknowledges sometimes a moderate elevation in blood pressure is perfectly acceptable, sometimes it is even preferable. This shift demands that doctors move beyond simply applying a universal target and instead engage in critical, patient-centered thinking about the unique physiological and clinical circumstances of each individual patient, and within the demanding constraints of our current healthcare system, where doctors are often allocated a mere 15 minutes per patient. Adopting such a truly individualized and comprehensive approach presents significant practical and logistical challenges. To further illustrate the critical importance of individualized care, let me show you just how dramatically different two people of the exact same chronological age can be, and why their blood pressure management strategies must reflect these differences. Consider two individuals, both precisely 81 years old, yet their life situations and health profiles could not be more divergent. The first person is living independently, generally doing well, but is managing a constellation of chronic medical conditions. They have mild heart failure, chronic kidney disease, specifically stage 3, and are experiencing the discomfort and functional limitations of osteoarthritis in multiple joints. Their current blood pressure consistently registers at 158/88. Based on conventional generalized guidelines, their doctor is contemplating initiating aggressive treatment with multiple medications to bring their blood pressure down below 130. The second person is also 81 years old, but their health picture is vastly different. They are remarkably healthy and highly active, enjoying regular rounds of golf twice a week, and they have no significant medical problems or chronic conditions to manage. Coincidentally, their blood pressure also consistently measures 158/88. Here, we have the same blood pressure numbers and the exact same age. Yet the two individuals present with completely disparate risk profiles and health contexts. For the first person, the one with multiple chronic conditions, embarking on a regimen of multiple aggressive blood pressure medications carries significant and potentially dangerous risks. Those medications could inadvertently lower their pressure too much, particularly when standing, exacerbating their risk of falls. They could potentially worsen their already compromised kidney function, and they could induce severe dizziness and further increase their fall risk, which, given their osteoarthritis, could result in a catastrophic injury. A more judicious and reasonable approach for this patient might involve prioritizing lifestyle modifications first. Then, if medications are deemed absolutely necessary, a low dose of a single medication, carefully introduced and meticulously monitored with an acceptance of a target blood pressure of perhaps 140 to 145 systolic, rather than aggressively pushing towards the lower 130 mmHg CHARS threshold. For the second person, the healthy and active 81-year-old, a blood pressure of 158/88 might indeed warrant some form of intervention, but again, certainly not aggressive treatment. Perhaps simple, consistent lifestyle changes, such as dietary adjustments and increased physical activity, could effectively bring their blood pressure down to 145/84. For a healthy person of that age, this slightly elevated but stable blood pressure might be perfectly acceptable and safe, potentially without the need for any medications at all. Same numbers, vastly different people, requiring entirely different medical approaches. This paradigm is fundamentally what is meant by treating the patient, not just the number. Now, let me provide you with specific, concrete, and actionable steps you can implement, starting as early as tonight, to proactively manage your blood pressure in an age-appropriate and informed manner. First, if you are over the age of 70 and are currently taking any blood pressure medications, your immediate priority should be to purchase a reliable home blood pressure monitor if you do not already own one. Commit to checking your blood pressure at the same time each day, consistently for 2 weeks, once in the morning and once in the evening. Maintain a meticulous written log of all your readings. This consistent monitoring will provide you with an accurate average of your true blood pressure and will help you identify any discernible patterns or fluctuations throughout your day. Second, diligently perform the orthostatic blood pressure test that I described earlier. Begin by lying down comfortably for 5 minutes, then check and record your blood pressure. Immediately after taking the lying measurement, stand up and check your blood pressure again without delay, recording those numbers as well. If you observe a significant drop of more than 20 points in your systolic pressure or more than 10 points in your diastolic pressure, make a clear note of this to discuss with your doctor. This is a critical piece of information. Third, engage in an honest and thorough self-assessment of your symptoms. Are you frequently experiencing dizziness or lightheadedness when you stand up? Do you suffer from unexplained fatigue or a persistent difficulty concentrating? These seemingly minor symptoms might, in fact, be crucial indicators that your blood pressure is being lowered too much, even if your recorded blood pressure numbers appear to be within the normal range on paper. Fourth, schedule a dedicated appointment with your doctor specifically to discuss your blood pressure targets. Do not simply accept a blanket statement that you must achieve 120/80. Instead, engage in an informed conversation. Ask your doctor what specific blood pressure target they believe is most appropriate for you given your chronological age, your other existing medical conditions, and your current functional status. Bring your detailed home blood pressure log with you and present your orthostatic measurements if you detected a significant drop. This will enable you to have a genuinely informed and productive discussion, advocating for your personalized care. Fifth, and critically important, if you are experiencing any uncomfortable or concerning side effects from your blood pressure medications, speak up immediately and assertively. Do not suffer in silence, assuming that feeling dizzy or chronically fatigued is simply an unavoidable consequence you must endure. Often, medication doses can be carefully adjusted, alternative medications can be explored, or your individualized target blood pressure can be safely modified to significantly improve your quality of life while still providing essential cardiovascular protection. Here is what you now comprehend, a level of understanding that unfortunately eludes most people, including many healthcare providers. Blood pressure targets should never be universal or uniformly applied. A 45-year-old individual and an 85-year-old individual should not, under any circumstances, be held to the exact same blood pressure standard. For older adults, particularly those above the age of 75, a systolic blood pressure comfortably situated within the range of 130 to 145 mmHg is demonstrably associated with the longest survival and the highest quality of life. Conversely, maintaining a systolic pressure lower than 120 mmHg significantly increases the risk of dangerous falls, orthostatic hypotension, acute kidney injury, and potentially accelerated cognitive decline. While a systolic pressure higher than 150 mmHg does increase cardiovascular risk, the true sweet spot for older adults is found in that moderate middle range. You have learned that orthostatic hypotension, that precipitous drop in blood pressure upon standing, is often a far more dangerous and immediate threat than a moderately elevated sitting blood pressure. You now possess the practical knowledge of how to test for it in your own home. You understand the fundamental physiological reasons why seniors necessitate different blood pressure targets, the natural progression of arterial stiffness, the slower and less efficient responses of baroreceptors, and the altered metabolism of medications within an aging body. Most importantly, you are now equipped with the precise language and comprehensive knowledge required to have a truly informed, confident, and proactive conversation with your physician. You are no longer merely a passive recipient of medical advice. You are an empowered and educated participant in your own healthcare journey, and that in itself is profoundly empowering. You are now significantly more informed about appropriate blood pressure management in older adults than probably 90% of people your age, and indeed, many healthcare professionals. You understand the critical nuances. You know that a one-size-fits-all approach simply does not work. If this information has provided you with clarity, if it has answered long-standing questions, or if it has imbued you with the confidence to advocate effectively for your own health, then I have accomplished my mission. I invite you to drop a comment right now, simply stating "informed." If you feel more equipped to discuss these vital matters with your doctor, please consider sharing this essential video with any friends or family members over 65 who could profoundly benefit from this life-changing information. I also encourage you to subscribe to this channel, as my unwavering mission is to continuously bring you research-based health information that is not only accessible and practical, but holds the genuine potential to transform lives. In my very next video, I will delve into the 3 specific supplements that rigorous research unequivocally demonstrates can actually support healthy blood pressure naturally, and importantly, expose the 2 incredibly popular supplements that are, frankly, a complete waste of your hard-earned money. You will undoubtedly want to see that, as the supplement industry is rife with misleading claims and deceptive marketing. I will show you exactly what the scientific evidence truly says. I look forward to seeing you there. This video is strictly for educational and informational purposes only, and is not intended to provide or substitute for professional medical advice. Blood pressure management must be highly individualized based on your complete medical history, your current health status, and all other pertinent factors. Never adjust, discontinue, or initiate any medications or treatments without first consulting with your qualified healthcare provider. The information presented herein is based on current research and understanding, but should never replace professional medical care. Always consult with a qualified healthcare provider before making any changes to your treatment plan or health regimen.